Hi, it's Dr. Betty Robin with the Dentistry Rising podcast. You guys probably know me as a dental practice sale broker from Orange County, California, or as a dental attorney from Tustin. I've started this podcast to really try to help you do better in your practices quicker and let you know what I think are the secrets to success in dental practice. I've owned 3 different dental practices, 2 that I operated myself and 1 was associate run. And I've also had thousands of clients as dentists. So I have a clue on what works and what doesn't work. So I hope this is helpful and happy listening. Okay, today we're going to talk about the last part on how to sell patients treatment or how to get your treatment accepted. I feel very strongly that the doctor should quote the fee. I know I'm going to get a lot of pushback on that, but that's what I think. And I have done it, and I have produced big numbers. So if you're going to disagree with me, I'd like to know you've actually been in the arena and done it. And many of the most successful doctors quote their own fees. Now, I'm not saying you're going to quote the fee down to the penny. Nor am I saying you're going to discuss insurance or detailed payment options. But I do want you to have the confidence to get the total fee out of your mouth to the patient. You don't have to be totally precise, as I said, but if your veneers are $2,000 a unit, I do think you should be able to multiply by 6 or 8 in your head and quote the approximate fee. I mean, you could say you're looking at around $20,000. I mean, that's a fee quote. Okay, so hear me out and I'll explain more what I mean. The bigger the fee is, the more important that it comes out of your own mouth, in my opinion. Now, does it really matter if you don't quote a fee for a filling? Probably not, but I think quoting fees for smaller procedures helps you get into practice to quote bigger fees and more extensive treatment plans. I mean, if you can't quote a fee for a filling or a single unit crown, how do you expect to quote a fee for a veneer or a full mouth reconstruction? And do you really expect an employee to quote a fee better than you could for something that might exceed her annual salary? I mean, an employee's money level is not nearly the same as yours. He or she does not live the same way you do, does not eat at the same restaurants, does not stay at the same hotel, etc. And they also probably do not spend $50,000 or $100,000 on their teeth. So the most important thing is that you handle any objections or questions that the patient may ask, and you are by far the most qualified person to do that. So yes, I want you to get in the habit of regularly quoting fees. When you quote the fee and you get an objection, if there is one, handle it. So how are you going to do it? Let's talk about a big case, though they're basically all the same, but just as an example. So going back to the beginning, I think first you need to look like $1 million and your office has to be impeccably clean and organized. Second, you have to have presented the treatment and have appropriate x-rays, models, etc. And now we're going to talk about the fee. You're going to say the fee in one sentence, and usually one sentence only, and then you are going to be quiet. It's really hard to be quiet, but you're going to be quiet. So let's say you're selling 8 veneers. So you're going to say again a simple sentence. The 8 veneers on your front teeth that we talked about, which I really think will dramatically change your appearance, will cost $20,000. Period. Then you say nothing. The next move is the patience. So being quiet is a very effective sales technique. What the patient says next tells you what they're thinking and what you should do or say next. So the patient may hesitate, and the best case scenario say, I have some money in savings and I think I want to do it. At which point, again, you say very little. Do not talk through the close. They've bought. So you're going to say something like, that's great. I'm very excited for you. At this point, I would personally book the appointment. Don't leave it to chance. So I'd say something like, I need about 4 hours to do the treatment. I prefer to do this kind of extensive treatment in the morning while I'm fresh. I mean, who wants a tired doctor? And you don't want afternoon large cases. I have an opening at 8 a.m. next Friday. Would that work for you? Bring that baby home. So if you can't get there, then you can have your front desk person work on scheduling, but I would try to schedule because the patient is much more likely to accept an undesirable time, perhaps for them, with you than they would with a front desk person. Now, do not ever go into insurance plans or payment plans. That is your front office person's job. But your job is to get the money out of your mouth. And I would keep going down that trail until you can't reasonably anymore. For what I mean, like in this scenario, if the patient says, I think I want to do it, but I need to make payments, stay with it for a moment because the patient may commit to higher payments with you than they will the front desk. Tell them your policy clearly and concisely. So you might say, the most we do in the office is to break it down into 3 monthly payments. Can you do that? Again, be quiet. If they can't, then tell them Susie at the front desk can work with them on some outside credit options and jump back to scheduling, making the assumption the money will be handled. I mean, at this point, you aren't out anything. They're telling you they want to do it. You know you have options like Care Credit, Greenlight, or what's that other? There's several other new ones. So I'd go right to scheduling and go back to that same conversation. If the patient talks about insurance, I'd say something like, insurance doesn't usually cover these kind of procedures, or at most their coverage is $1,000, whatever the case may be, but I can have Susie check for you. In this scenario, I probably wouldn't schedule because the patient may be saying they won't do treatment without insurance, but use your best judgment. You must believe that you are the most effective treatment presentation person and money-getting person in the practice. I don't care how good your front desk person is. And this is a really good use of your time, better than drilling that crown in the next operatory. Close the sale. Why is this? I mean, I think the biggest thing is you own the business, you totally care, and most importantly, you have a much higher money level than any of your staff. So you're way better equipped to deal with their objections or questions. Now, if a patient starts asking questions, especially technical questions or timing questions, recognize that they have already bought. So again, don't talk through the close. So answer their question for this purpose very simply, then go back to the close, which means scheduling. It can be hard to recognize when somebody's already bought, but a big sign is they start asking questions like, will I have to wear temporaries? Can I go to work next week? Will it hurt? That patient has bought. Answer their question in one sentence, and then either go back to money or go back to scheduling wherever you left off. So practice, track your success with each patient, and you can do it. After the patient has definitively scheduled, signed your contract on money or whatever it is you require, then you start going into more details. For example, you might want to take photos that day or models or both, or you might want to give them consent forms or more detailed post-care instructions. That's all fine and good, but it should not be done during a treatment presentation. Questions during a treatment presentation should be answered very simply, usually in one sentence, because that's not the point. The patient's deciding, the patient's wavering. They aren't really asking the question for an answer, but instead to buy more time, which doesn't mean that question has to be fully answered right then. But obviously the questions have to be answered, information has to be conveyed at some point. This isn't the right time. Get it? Now turn on your phone and start practicing. Turn on your video on your phone. If you do these 3 steps, you will do very well, and you will get better and better at getting patients to accept treatment. Make a game of it. At least make an Excel document of it. To sum it up, this part anyhow, quote the fee, multiply simply in your head to do that, and make it approximate. It's going to cost you about $20,000. Schedule large cases yourself. Use silence as a tool and to your advantage. And lastly, understand when a patient has accepted treatment, especially noticeable when they start asking technical questions. Okay, you guys, I want big things from you. Keep me informed on how it goes. Good luck. Thank you for listening to the Dentistry Rising podcast, Dr. Betty Robin. Please subscribe on iTunes so we can get better and better at helping you make your practice dreams come true.